So people come in, they say, Doc, I hurt all over, I'm exhausted. You ask them one question, which is, can I get a good night's sleep? Hint, hint, okay. You say, hey, you blew a fuse, and you want to figure out how they blew the fuse, what caused them to trip a circuit breaker. One simple question really helps separate out the groups nicely. When did this illness start? Or you can ask them, did it start suddenly or gradually? If people say, well, you know, I've been sick for about 5, 8 years, but felt kind of lousy for 8 or 10 years, gradual onset. Gradual onset, you want to think about hormonal problems like low thyroid, perimenopause, candida infections, classic, probably most important single infection, autoimmune diseases, lupus, rheumatoid arthritis, Sjogren's, all of these will trigger very frequently a secondary fibromyalgia. And what happens is that the rheumatologist doesn't recognize the fibros there, so they keep whacking them with prednisone and chemo agents and really heavy-duty medications trying to knock out the inflammation, when the problem is not the inflammation, it's secondary fibro. You treat with what we'll talk about today, that will get better. So when you have somebody with autoimmune disease, ask them, can you get a good night's sleep? If they say no, consider fibromyalgia being present as well. Anything that disrupts sleep will give a gradual onset, severe stress. But some people have a sudden onset. You ask them, when did it start? And they say, April 17th, 1997. Sudden onset. And usually in those cases, it's going to be post-viral or post-infectious. It can be after parasite or even other infections, after an injury, and after pregnancy. People do fine during pregnancy. It's after the baby is born. It's like pulling the hormonal carpet out from under them and they crash and burn.